Hi, everyone. Welcome to the 2017 Pediatric Summit webcast. I'm your host, Amanda, and we are so excited. We are less than 3 weeks away from the Pediatric Summit, October 6th and 7th. Purchase your tickets yet? Please go to the pediatricsummit.com. You can look at the lineup there and purchase your tickets for this amazing event. We've had some awesome doctors, and it's going to be full of content that they're just willing to give and share with us. So we're really excited for it. Today, I have the honor of introducing one of my favorite doctors. Dr. Jarboe is the funniest, kindest lady I've ever met. I love seeing her at seminars, whether it's her on stage or her sitting beside you. She is always so fun to talk to. This is in Massachusetts. She has 2 practices there with her husband. And she also started Bloom, which is an amazing coaching group where she will just give everything that she knows. She's all about giving and serving and sharing with people. And I'm so excited to have her here today. So Dr. Pam, how are you?
I'm great. Thank you so much for having me here today.
Of course.
So glad to be with you. Yes.
If you want to share a little bit about you. So you have 2 practices with your husband. You want to tell us how those got started?
Sure. I've had many different practices in my evolution. I've been in chiropractic for 30 years, as you know. I started as a CA when I went to Life University, and I graduated in 1995. And I had a practice down there, and then we moved up to Massachusetts, and we had a practice in Bedford, Massachusetts, but we decided we really wanted to live in another town called Groton, which I joke around and say it's a town of 12 people and 47 cows. A really tiny town, lovely place, and we just opened up a second office because we had 2 people who used to be in our practice and practice members become chiropractors, and so we really wanted to support them in getting to their next level. So now we have 2 offices, and like you said, I have my coaching company, Bloom, and I do give it all.
That is one thing I love about you. I feel like you never hold back, and everything you know, you're just like, this is what I know, and this is what worked for me.
Yes, it's like a fire hose. Well, I like what you just said too, because a lot of times people will say absolutes. And one of the things I actually wanted to talk about today as we talk about how to help people to understand the possibilities of chiropractic for the pediatric community, I think we also need to pay attention to regions. You know, you and I were talking about marketing and your background, and, you know, what works in one region doesn't always work in another region. And so regional marketing is really important. It's very funny up here in Massachusetts because regional marketing can be hilarious. I'll give you an example, like Dunkin' Donuts did this commercial with Casey Affleck. I don't know if you've seen it.
No.
I'll post it under the video just for entertainment, but it's hilarious because he like ends up throwing a Dunkin' Donuts at some car because the guy is too snobby or something. And, you know, so anyway, it's just funny to like think about different regions. You know, what works in one part of the country or one part of the world doesn't always work in another part of the world. So, you know, I mean, I think there's a basic humanness that we all share, obviously, but we can definitely pay attention to regional things that are happening and how to get people to understand chiropractic, especially.
How do you learn what your region is going to be receptive to? Like if you're moving to a new area, starting up from scratch, how do you find what your region?
Market research. Well, like one of my clients just recently opened up a practice in Virginia. And so I have clients that have very vast backgrounds. Some people have been established for 30 years and some people are just brand new. But what I suggested to the woman who is just starting brand new is to just go around and create her own little survey of like 5 questions, but make it really casual. Like, hey, you know, I'm just moving into the area and I just wanted to, if you don't mind, can I ask you some help? You know, where do you think it would be best to move, you know, to open? Where's your favorite place to get pizza? You know, what have you heard about chiropractic? If you're going to specialize in pediatric chiropractic, you might want to ask about that. And maybe even say, here are 3 names that I'm considering naming my business. What do you think would be the best one? Just so that you get you're opening the doors and you're just hearing what people have to say. You can also look at what other offices are offering and look at what is there. that doesn't mean that what you have to bring wouldn't work. You could be the disruptor,
Right.
and change it up. But to understand what the current beliefs are, you have to talk to the people in the area. I'll give you an example, because I had a practice in Atlanta, and my experience in Atlanta when I worked in Sandy Springs was that everybody went to a chiropractor. I'm kind of exaggerating, but I say this when I spoke out at the Wave in California, and I was like, it's like unicorns and rainbows out here. Like, everybody's so happy. Whereas in Massachusetts, people have a little bit more of an edge. And so I'm going to approach someone differently. But when I was in Atlanta, what I saw was that everyone went to a chiropractor. When it came to Massachusetts, people were very suspicious of chiropractic. It's a, pretty medical town.
Right.
And I had a lot of work to do to educate people and to help them to understand what it was that I was offering.
Mm-hmm. When you're speaking to a mother and you're trying to get like a child to come in, do you feel like that tone needs to change a little bit, or how do you?
Yeah, it's a great question. Well, I think about it, like, you're not a mom yet, right?
Right.
Right. So, it's hard to describe, what it's like to be a mom, but I don't think there's any place where you're more vulnerable. Do you know? I mean, you're just so vulnerable because you've never loved a creature as much as you love your baby, and you're responsible for them. It's different than making choices for yourself. Yeah. So right away, I think the conversation changes just because of that to me. Mm-hmm. I'll give you an example. And I know I've talked about this at some seminars, but one of my really dear friends and my son's friend's mother approached me when, our kids were little. And she said, Pam, I just noticed that you do things really differently, and your son is hardly ever sick. Because, we were really in each other's lives. We were taking care of each other's kids while we were working. And so we were really intimate, in each other's lives. And so she said, I just noticed, like, Max is hardly ever sick. What are you doing? And I hadn't, like, shoved chiropractic down her throat because I really wanted her to come to me. I felt like I had different relationships with her than, the public. And I really wanted it to come from her rather than me pushing it. I really wanted her children to get care. And I know a lot of us have this experience, Yeah. So anyway, what came out of that was that she was really afraid. So in my notes to have this conversation today, I was thinking about fear mama. That's what I call it. Like, there's a part of our brain. Right. There's a part of our brain that is trust mama. But I mean, it is like, me, do we trust ourselves? Do I trust myself to know what I'm doing for another human being? I became a mom at a really young age, and I just felt like, I don't know what I'm doing. Like, should I really be in charge of this other person? And then I'm going to make healthcare choices for him. Yeah. Even though I knew chiropractic, I had a lot of fear about it, which a lot of chiropractors have no fear. You know what I mean? They really trust that this body can heal. I didn't get raised in that kind of environment. And so it was very hard for me, but trust comes in many tiny little experiences. And I got to see, wow, my child does well with no interference, my child Yeah. does well with, all these things that we know make common sense, good sleep, good food, positive environment, no nerve interference. My child thrives. So that was something I had to learn, though, in many tiny little experiences. So by the time my second child came, I'm like, oh yeah, he's fine, right? You get more confident. Yeah. Mm-hmm. So think about that for the public. Even though I had all this knowledge and this information, I still didn't have a visceral trust of myself as a mama and my baby. I had some primal fear. Mm-hmm. So a mom in the public has a lot of fear. And so it's really hard to just do what we're saying. So what I saw with this mom was that she was saying to me, so you don't give him an aspirin when he has a fever? Like, that was mind blowing. But think about that, right? Like, we're laughing right. because we live in the bubble. You know what I mean? We live in a bubble, and we just don't realize that's what it's like. And that was really helpful for me to see, because I had been in the bubble for so long that I forgot what it was like to be outside. Right. I forgot, and so the first time ever that little smushy, had a fever, that she allowed it, was super scary. She was on the phone with me all the time. In a staff meeting, I think she called both my husband and I like 4 times. We were like, I might have exaggerated at one point and said it was 10, but she was really afraid. And then I really got to see, wow, it's super scary. So then think about, I see pictures sometimes on YouTube of us adjusting babies, and it's scary what we're putting up there. Right. I think we really need to understand a couple different things. Number one, what will it feel like to a child to get adjusted? That's an important concept to cover. It's so basic, right? But I don't always hear chiropractors talk about that. This is what it will feel like, you know, and to emphasize, like, they'll breathe more easily. They relax. They fall asleep a lot of times during adjustments. That's a great thing for us to show if we're going to show something.
Right.
I don't really recommend that we put videos up on YouTube, you know, about this. Maybe testimonials would be lovely, but anyway, to just show what it would be like to explain what's happening in the neurology, that might be really helpful for people to trust. And yeah, to show that it's not scary and to talk about what's possibly going to happen as a result of an adjustment. Yeah.
So how, besides showing them when a child's getting adjusted, like some of the things that do happen, how else are you going to tap into this trust with mother?
Right. Okay. Well, there's a lot of different things that you can do. Again, I just sort of modulate who I'm talking to. It depends on the chiropractor and the audience, but I'll just give you an example. Okay. I think a great idea is to come up with something on our websites that say how to pick the right chiropractor for your child, right? Instead of me saying all the things that I'm so awesome at, I'm going to offer something for you so that you can choose who you want to go to. And of course, all the things that are in there are the things that I offer because I'm an awesome chiropractor for your child.
Right.
Or let's say you could do something like a series, whether it's a podcast or a video, but how to raise a healthy child,
okay,
you know, in the modern world, or how to give your child every advantage, because that's what, if we are really looking into the psychographic of a mom, that's really what they want, is to give their child every advantage possible. You know, there's actually like a darker side of the motherhood community where they're like trying to compete, you know, and have their kid compete, you know, especially up here, you know, you just want to really get your kid into the best school possible. And, you know, the whole strategy is to be able to retire and say that your kid's a doctor and that they're going to afford a great nursing home for you. I'm just joking, but not really in a way. There is, right? There's a little bit of truth in there. So, yeah. So those are ways that you might bring people towards you, you know, to have classes about it. Definitely, like, so let's say I wanted to be a pediatric chiropractor, which for me, that isn't my only channel. But if that was my real focus, what I don't want on my website is conversation about adult new patients or adult patients talking about low back pain. Like, make the message congruent, right?
Yeah.
Because I've often seen that. So if a mom was going to your website to look to see, is this person safe? Is this person a person that I would go to? Do other people who are just like me go here? Then you need to show them people who are just like them. Yeah. I know you came to make your impact, so you understand what I'm talking about. So yeah. Yeah.
I definitely recommend that everyone goes to Make Your Impact, because you learn all about branding yourself and really how to like form the practice you want.
Yeah.
And I think that's really important.
I think a lot of times we're focusing on promoting in chiropractic and we're just doing activities, but it's not really thoughtful. And sometimes we're just exerting a lot more energy with a lot less results than what we would really want.
Right. Yeah. What do you think? So I was recently with Dr. Tony Ebel, and a student had asked him about doing screenings for pediatrics. And he said that, you know, because you have to pick the right screening. If you want children in your practice, you're not going to go to the fair or places like that. And one of the things, he made a joke, but he said, this screen on your cell phone is the screen that like parents are looking at sitting at soccer practice and stuff like that. So what's your opinion on screenings if you're trying to get a pediatric population?
Sometimes I say things just to be funny. So I'm kind of being funny about this and facetious, because screenings also, I believe that there is a regional component, and there is a component where it matters who does the screenings. So if I'm doing a screening and I feel awful doing a screening, I won't be as effective for chiropractic and also for my own office, because I'm exuding this. And so like one of my clients had said at some point, screenings are an exercise in humility. And, you know, I laughed about that. I thought it was funny. You know, I joke around and say it's an awkward-tunity instead of an opportunity. But I mean, I have friends who have built their practices on screening. So, but okay, I have a screening thought because I see pictures of screenings all the time. You probably do this too. You know, when you really have studied a lot of marketing, you look through that lens. So I saw this person who was talking about a pediatric practice, and she was doing a screening, and she had this big picture of a football player talking about maximum performance at her screening. And I was like, in my head, rolling my eyes at that, just because, you know, a lot of the chiropractic organizations have created marketing from peak athletes who are making multi-millions of dollars talking about how chiropractic has helped them to keep earning that and stay at this Olympic athlete level. Whereas, like, as a mom of 3 kids and I want pediatrics, this is not the message. It's confusing. So anyway, I think like that's part of the problem in chiropractic is that we're confusing to the public. So I think screenings could work. You know, my assistant is pregnant right now. She's going to have a baby in October, and she went to a birth, you know, fair or whatever, expo. That's a great place. You know, it's a great place, and to make your whole table all about babies and health. And, you know, I think that could be a great place to put out information, but you can't do an exam on a baby at a screening. I believe it's not like you're going to do a weight bearing test and a posture analysis, and, you know, but you can, it's a great place to share information.
Get your name out and educate.
Yeah, there might be different outcomes. I think one of the key ingredients of a screening like that would be to actually develop alliances with other businesses who see a lot of babies. That might be the best outcome, is that now you actually can do co-promoting. You know, maybe they could be a sponsor of a series that you do on how to raise healthy children, and they send it to their list. And, you know, that might be, it might be a better way of getting your name out on the screen, you know, as he was saying. But yeah, but not necessarily, because a lot of times when we do screenings in chiropractic, I think we actually have a really microcosmic view. So I'll tell you a story. I had a coach when I first started this practice in Groton, and I remember calling my coach and talking about how I went to Groton Fest, which is this annual festival where all 12 people who live here go. I'm kidding. It has like 10,000 people go to it, I believe. It's a big festival, but anyway, I was talking to her and I said, you know, I was really disappointed because I only signed up 26 people. And she was like, 26 people, that's awesome. And I was like, really? I'm like, it's kind of depressing. There was 10,000 people there. Like, so again, it was expectation. And we have to look at that as chiropractors, because a lot of times we're looking at success based on what everyone else is doing. And I was never doing that. I just was creating my own ideas a lot of times. And then later on, I would talk to people and just get an expanded perspective. I wasn't basing it on what other people were doing. It was really an internally driven process. So she was like, 26, that's amazing, blah, 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 like how great that was. And I really felt disappointed. So, you know, I think I shared with you, I decided what I really wanted to do was, people were deciding whether or not they needed a chiropractor based on their current symptom. So they were walking by the table and being like, I don't need a chiropractor. And so we need a better way of addressing that. Like, how would you know? You could say, oh, I don't need a dentist today because my teeth don't hurt, but that's not true. We brush our teeth, we floss, we go to a dentist. I don't need a cardiologist today, but how would you know that? Unless you go and got checked and found out that you don't have any blockages. But most of the time, people do have blockages and they're walking around not knowing it. And so people have these blockages in their neurology and they're walking around not knowing it. But we haven't figured out how to get that information out there. So I developed, you know, some sort of what they would call lead capture. I know you know those words, but not all chiropractors do, but just some way of sharing my regular newsletter. Is there something you could offer so that if people, quote unquote, aren't ready for your product at that moment, they actually become connected to you and start hearing from you and start getting your videos in your newsletter. And that's a really smart idea if you just broaden your idea. It's not just about signing people up that day. And the other thing I often think about when I do these is, you know, who's in charge of creating relationships with all the other people who are there, because sometimes that's an even bigger source of referral. If you really, you know, educate someone who sees a lot of people and you get them to be your raving fan, that's a huge win from a screening. And so I think we sometimes need to adjust our expectations about what makes a successful screening.
Yeah, definitely. Because I remember you saying you had a patient that came back like 5 years after sending those emails for so
Yes.
long, and then you finally came
Right.
in.
Yeah, it was hilarious. I mean,
Yeah.
right, it's a weird thing, but why not let people choose? And so she liked receiving it. And every newsletter, we always have some sort of educational material that clicks back to our website. And
Okay.
so, yeah, to be able to continually provide that and allow people to come when they're ready to come.
Hmm. Yeah. So I know I told you a little bit about my background, but I was a marketer for a chiropractor before I came to school. So I heard all the rejections, and I came to chiropractic school, and everyone in our bubble thinks that everyone knows what chiropractic is and everyone loves it, and screenings are easy. Communicating chiropractic is easy. And so what are some ways that we can deal with objections pertaining to children?
Right.
Because I actually didn't know much about pediatric chiropractic before I came here. So I think there is a lot of rejection there, and I have those objections.
Right. So I think that the objections come usually in three categories: efficacy, like is it effective, or do I need it? All those kind. And what I recommend is that, well, first of all, there's a mentality to overcoming objections gracefully. And I think I might have mentioned this one to you, that it's about getting punched in the face sometimes, because it feels like that, right? I go to extremes just to get a point across, but it really does feel like that sometimes. I have had people say really uneducated and uninformed things to me at a screening, and it takes me back because I love chiropractic so much and I love humanity so much, and I want for them to have this. So when someone says something that's just so out of the park, I just like, it really does feel like, whoa, I just got slapped. So the first thing mentally is to just know it has nothing to do with you. It's so not personal. This is not a fight. This is not them against you. And so right away, if you can depersonalize it, you're going to be so much more successful. Whereas if you get defensive, it's going to go nowhere. It's just not a good scene. So we always find a way to agree when there is an objection. So our step process is, number one, be really mindful of not taking any of it on. And that takes time. Sometimes I coach CAs and doctors because we do a lot of team calls. I think we spent 6 weeks this year so far on overcoming objections, because it's just, you need to be strong inside yourself and be like a well-rooted tree. The wind is blowing, somebody's saying something, but you just stay in what you know. And so, so we just stay calm and just say, oh, wow, like, that's interesting. Either I say, I've never heard that, or sometimes I might say something like, I've heard that mentioned before. I never say I get that a lot. I don't want to add social proof to whatever their idea is. And so I just say, wow, it's interesting. I think I heard that once before, so maybe some people feel that way. Or sometimes I can totally relate to what they're saying, because I have to say, I never drank the Kool-Aid right away when I get into chiropractic. It took me time to understand chiropractic and really get it. So I'm patient with people who don't get it right away. To me, in a way, they live in this world where everything that is natural is suspicious. And so we're whacked. They don't get it. It's unnerving to them what we're talking about. And I understand that. I used to feel that way. So first of all, a lot of times I can relate, and I just totally depolarize it by being like, I know, right? It's like so different. But, I used to feel that way. And then I found out, and so that is a technique that's called Feel, Felt, Found. I know I probably mentioned it during Make Your Impact, but it's about how you really help somebody to go from where they are and be like, I get that you're there. And also, almost everybody else, all the cool kids are over here. I used to feel that way. And then I found out, actually, there's a lot of research about brain changes as a result of adjustments and the importance of the integrity of the nervous system. And would you be interested to know, like, how this might be the kindest, smartest thing you could do for your child? Because I'd love to share it with you. I ask permission, right? And so then the person has to say yes. And some people might say no. And really, I don't feel like fighting that battle. But it's very rare that someone says no. Most of the time they're like, well, yeah, I do want to know that. Would you be interested in knowing how this actually might be a secret advantage that you want to give to your child? Right? So ask a way to get permission for the next step. And then we ask a lot of questions to get them to the point where they might be curious more. So it's a permission-based, a question-based, I'm drawing them in. What do you think is the most important organ in your baby's body, in that cute little smushy body? Again, I'm like making it nice and fun and light. Right. What do you think? When you look at that perfect little lusciousness, you know, what's the most important organ?
The brain.
Right. So a lot of times people will say the heart, you know,
heart.
A lot of times people will say the heart. And so I'll say, okay, but what tells your heart, the baby's heart, to beat faster or slower? And I especially might focus on whatever the symptomatology is that they've talked to me about, whether it's their stomach or their digestive system, you know, maybe they're not pooping and, you know, so what do you think is in charge of that in your body? So, you know, I kind of talk about the brain as the CPU. And so how does it communicate through the body? In an adult, there's 45 miles of nerves. So if there's a trend, so think about that. And then people are usually like, whoa, 45 miles around where I live. I'll say, right, that's like your commute, because I know people, right? So think about it. If there's a traffic jam in your commute, how does that make your day? Does it make it easier or harder? And everybody's like, harder. Exactly. So if there's a traffic jam in your neurology, is that going to make your body's work easier or harder? They're like, harder. It's just so simple at that point. So find an analogy that they could relate to, but somehow make it brain and body based.
Mm-hmm. So when you say that you bring it back to their symptoms, do you find that if they come in for symptom care that they end up like leaving right after their symptoms?
I really think this is one of the biggest challenges that pediatric chiropractors face. So many of my clients are like, I want to take care of pregnant moms and babies. And what happens is those pregnant moms come in and those breech babies, you know, turned down, you know, face down, those babies that, you know, couldn't sleep through the night, sleep. Colicky babies are better. Non-pooping babies, you know, poop. I don't know. It's like all these things, you know, miracles. And then the person's like, oh, you fixed me. Thank you. Bye. And then you never see them again. And it's a huge source of pain for pediatric chiropractors, and they see it over and over again. How do we help people to understand and move beyond the symptomatology? It's so dramatic for us. So I think the first step is that we love solving problems in a way. It validates us. See, I told you this was great. See, now there's proof it was great. But now we dug ourselves into a hole because we made it about symptoms in the first place. Right?
Yeah.
So right from the beginning, if we can talk about brain body communication, and when, you know, say about a symptom, well, you're lucky. You're getting a sign that there's a traffic jam here. But a lot of times there's a traffic jam and there is no sign. So then I'll ask a question. Just tell me, what do you think? What percentage of your nervous system is devoted to feeling versus function? Like, what do you think? You know, what do you think it would be? You know, and so someone is usually looking at me blankly. I'm like, do you think 50-50, right? Or do you think, you know, feeling would be more? Because most people will say feeling is more because they feel more, right? And so I'll say, right, so that would make sense that it would be like that. And then I'll say, it's actually 90-10. It's 10% of your nervous system is feeling. So 90% of those nerve fibers are actually devoted to the function. Have you ever had a toothache? Have you ever had a cavity and not had a toothache? You know, right? Like a lot of times people go to the dentist and find out that they had 7 cavities. And you wouldn't want that for your child, right? That you didn't brush their teeth, that you didn't bring them to the dentist. You would feel like, oh my gosh, like I failed them. You know?
Yeah.
So I want to make sure that we keep this neurology clear, which is way more important than your teeth, in order to make sure that your baby has the best chance possible to have a strong immune system, to have the best brain function. I know you want that too, right? Get agreement. I know you want that. I know I want that. So let's get to work. But like somehow that has to happen in that new patient appointment, because I think what's happening is that we're focusing on trying to like, oh, I'm going to win them if I get them to understand that chiropractic can help them with this symptom. And then when it does, then they'll love me and they'll love chiropractic. And they do in a way, but for a symptom. And you solved it, so they don't have a need.
Yeah.
So definitely. We really need to preemptively have that conversation.
Mm-hmm.
It's very hard to go back afterwards. Mm-hmm.
So to go back to the rejections, you named the one is whether it's effective or not.
Okay, Thank you. I know there's so many thoughts, right? Is it effective? So there's a bunch of objections that come under efficacy. Is it for me? Are you the chiropractor for me? Does chiropractic work? Do I need it? There's a bunch of objections. But then the other one is time. You know, I'm too busy. I have 27 children and so many activities, and there's not a chance in the world. And so I use a study that was done where Donnie Epstein had done this study where they scan the brain and they ask the person to wiggle their toes. And they scan the brain. Have you seen that one? Mm-hmm. It's a great study, and I can try to include it in the links below. But all the centers of the brain light up, and then they adjust the person and they scan the brain, and just the centers that are responsible for motor control light up. So I always bring that out and I say to a mom, do you ever have that day where you just feel like you're like running in a million directions, but you're not getting anything done? You're not getting anywhere? And moms are like, heck yeah. So I'm like, this is one of the things, it can save you time. I'm telling you, I hear it over and over again. And the truth is, if your children are healthy, you're going to be able to stay on track. This is an investment in your time that is going to give back to you. Whereas there's so many things you're going to do with your time that are going to drain you. Yeah. So that's one of the conversations that I have. I've never heard
anyone bring that study into this. I like that a lot.
Yeah, it's really helpful. I like to mix research with my analogies, and because, you know, it's not just, you know, smack talking. This is really brain function. And so then the other objection that we get is about money. And so we printed out a list of the cost effectiveness studies of chiropractic. And so we have a sheet that we hand out to everybody, and we just talk about how, you know, your healthcare, you have to think about where to put your healthcare dollars and where, again, is going to give you your greatest return. And my experience in chiropractic is that this is the best use of your healthcare dollars, because people have to choose. I mean, I've had people have conversations with me about, like, I'm not sure whether or not we should do braces or this. I also, I mean, outside of that conversation, so I give them cost effectiveness studies, but outside of that, and again, I think some of it starts with the doctor. Like, so when I first started in practice, you know, I graduated and I was like, oh, well, I want to like take care of your finances and I want to take care of everything in your life and chew your food for you. And now I just don't feel that way. I kind of feel like, be smart, people. This is a very important use of your healthcare dollars. I get that it's one of the smartest, kindest things you can do for your healthcare, for your whole family. With your, you know, it's the best use of your time and your energy. So, you know, meaning your money. Right. And so I don't really have a lot of qualms about that. And I think that that gets translated. But in the beginning, I did. In the beginning, I was like, oh, like I was apologizing, and I just don't feel that way anymore. Think about how much we save people. Right. You know, we really do. And if you look at those cost effectiveness studies, you'll see they really show, the numbers show that this is a really smart use of dollars.
Mm-hmm. Do you do like family care plans, or do you stick more?
Yeah, we have wellness plans. And so I think that that's a really easy option for the people in my community. And again, there's, you know, pricing is part of marketing. So figuring out pricing, number one, the number that you want to create. And so a lot of times people say plans, and there's a lot more to it than that. You need to figure out how much it's costing you to adjust people, so that you know that you're making a profit if you are offering a plan. So I just want to say that, because a lot of times people say plans, but they're not giving you the backstory of it. So figuring out the numbers of plans is the thing that I do with my clients based on their overhead, based on what they want to create for themselves. And so then there's a presentation. And so in marketing, there's a whole presentation of a plan that really needs to come into play. And then there is the physical presentation, and then there's the actual learning how to present those as a doctor or as your team, and then the implementation of it in the office. So it is a complex thing. Once you get it down, it's easy, but you know, I just don't want to be cavalier about it and say, oh yeah, we offer plans, and then people are like, oh, okay, for $100 a month. It's a little bit more than that. You have to really look into what makes sense. But I want it to be something that I do believe there is a universal concept that people value what they pay for, and they pay for what they value. And at the same time, a value in New England is value. I know that's like, how many times I'm going to say that word, but no, people value value. So think about it. Your target, the people that you might be talking to, they might love like Mercedes or Coach, you know what I mean? Because you have this higher end client. Or you might be looking for more of like middle class people. Like around here, you get a lot of people who are the millionaire next door type of people who have a lot of money, but they're not flashy about it. So they value value. So that's an important thing when you're strategically pricing. So we just need to consider that and think about what is the region that you're working in.
Mm-hmm.
There's not a universal
definitely.
concept. You really do have to pay attention to region. That's my experience.
Mm-hmm. No, that makes sense, definitely.
Mm-hmm.
Do you have any last thoughts that you want to share with students or doctors?
Well, what I want to say is I think this is an amazing conference that you've put together, you know, and I'm really excited because I think it's an important piece of practice that a lot of times people will get nervous about and feel inadequate, and there's nothing to feel inadequate about. I'm excited to look at the lineup of people that you have, and I wish that I could make it. I'm really excited for what you're offering. I think it's going to be incredible, so I think people should definitely jump into it. And I also would invite them, if they want to learn more about my services or any of the free offerings that I have, they can go to my website, which is kyrabloom.com. I'm happy to, you know, give any of those resources to people and support in any way I can.
Awesome. Dr. Pam, thank you so much for being there with us today.
My pleasure.
And that was our last webcast 2017. So thank you all that tuned with us the entire way through. And don't forget to get your tickets for the Pediatric Summit, and we will see you in a couple weeks. Bye, everyone.